Mhm. Good afternoon. My name is Dr. Lena Gamble. I am a board certified family medicine physician as well as a molecular pathologist. My PhD is in molecular pathology. And I am coming to you today for our live question and answer session. Um, we are simply doing a general session today, and I'll be taking questions from the audience as well as questions that have been submitted online from any of you who are watching. So, if you have a question that I don't answer or you have a question you'd like to have addressed, feel free to drop it in the comments, and I'll do my very best to get to it and get an answer to you. Now, I have to let you know that I'm here simply because I have answers to everything. Obviously, you know that's a joke, right? What I do have is an extensive amount of training and education, which allows me an opportunity to offer some context around some of the medical questions and concepts that are being asked questions about. So we'll get a chance to dive into some things today, and hopefully it'll give our audience just some background and information that allows you to make decisions for your own health. Okay. Now, as in all cases, I will need you to talk to your own regular doctor about very specific types of things that may involve your own healthcare in general. And that's a rule that we use simply because I don't know every person's, specific health history, what medications you might be on, etc. And so this isn't medical advice for individuals. It's simply information in the medical and wellness context. All right. So, with that being said, all the disclaimers out of the way, let's go ahead and get started. The first question that I received recently, actually, I'll see if we can get into that. It's why don't doctors prescribe all natural supplements, herbs, etc., instead of only pharmaceutical drugs? Now, that is a fantastic question. We get that question a lot, and I'll explain to you. I've got my marker here, so we might get to use the whiteboard a bit. I'll explain as best I can the thought process behind that. Now, this all comes down to one very important concept, and it's the basis of the way that we practice medicine here in the US, which is called evidence based, right? So we practice what's called evidence based medicine. Now, my training here in the US, I went to University of Alabama at Birmingham. My training is based on this type of practice of medicine. Now, there's different ways to practice medicine, right? So we know that, I was visiting Asia this summer, and we know that our Asian friends tend to lean a bit towards the traditional Chinese medicine at times, right? So that's called TCM, right? Just a different approach to the practice of medicine, right? You also have, like, say, Ayurveda, another different approach, right, to the practice of medicine. What else? There's energy healings, Reiki. Um, I don't know if that's an approach to the practice of medicine, but it is an approach to the practice of wellness and healing. But it's not, I don't think that it fits within this context. So I'll just leave these here. Um, Now we have different approaches again to the practice of to wellness practices and such, but they aren't necessarily, I don't think, going to fit into one of these big categories that have been around for centuries, right? So the way that our physicians in the U.S., and I'm particularly speaking to a U.S.-based market at this point, is the practice of evidence-based medicine. That's how we're trained. We're not trained in Ayurveda. We're not trained in traditional Chinese medicine. We're trained in evidence-based medicine. What does that mean? Now, it means that we give you treatments based on evidence. It's almost in the name, right? So I'll give you an example. How about people like stories? I'll tell a story. Say, for example, I have a patient comes in, her young son has been diagnosed with a, let's just say a leukemia, right? And if you have children, you can imagine how devastating this type of diagnosis would be, right? Now, pretend I'm the oncologist and I'm seeing your son for the first time, and we're reading through his labs, and I'm explaining to the parents the prognosis and such. And this is, it's pretty heavy, right? It can be life or death. It's very significant, right? So it's not to be taken lightly. This isn't a hangnail or upper respiratory infection. Kid doesn't have a runny nose. We need to intervene. We have to do something in order to change the natural progression of this disease, right? So we've got a disease that has a natural progression. We know what the natural progression is, right? If we don't intervene, the likelihood of this child dying from cancer is extremely high. Now, this is barring any miracle that God decides to do, right? That's always always a caveat. Now, God can intervene whenever He wants, and that's a real thing, and that does happen. And we have our medical miracles all the time, right? Um, but because we don't know when God might intervene, we do have our practice of evidence-based medicine that leads us to make decisions. Now, what if I, for example, say to these parents, right, who are carrying the burden of their young child with leukemia, if I say to these parents, I saw this thing on TikTok the other day, and there was this guy, and he took, this natural herb X, and natural herb X cured his cancer. I think we should give that to your son. Who thinks that's a good idea? Yeah, like nobody, right? That's not if I'm your oncologist. That's not a good idea, right? Not if I want to practice evidence-based medicine. Is natural herb X a good herb to take? Very much possible, right? Did natural herb X cure this other guy's cancer? Also very much possible. Then why won't I give it to these people's 2-year-old? He also has cancer, right? These are the kinds of questions that come up. I see them online. They come up. Well, if this person did well and they only took this natural thing, why aren't doctors just giving this natural thing to everyone else? So here's a couple of questions. Let's ask. Let's see. So the person on TikTok, right, had cancer, treated it with natural herb X. Natural herb X is our natural treatment of choice right now. Okay? Now, what type of cancer did he have? Is it the same type as the 2-year-old? That's important. There's not just one disease called cancer, okay? There's so many different types. Each type has its own kind of treatment that is effective for it. That's all I'm going to say about that. Cancer is one of my favorite subjects. I've been studying it for a long time. I don't want to get into the weeds. Let's stick to the story, okay? So we need to know what type of cancer. That information is likely not available to the level that I, as the person practicing evidence-based medicine, is going to want, right? So they might say, well, this person on TikTok had lung cancer. You know how many types of lung cancer there are? A lot, not like one, okay? This person on TikTok could have had, they could have also had leukemia. You know how many types of leukemia there are? Several. Is it the same type as the kid? Who knows, right? So that's one question. Other question, what dose of this natural herb X did they take? Right? We need to know that? How much did they take? We also need to know frequency. How often did they take it? We also need to know duration. How long did they take it? Did they take it for a week and the cancer was cured? Did they take it for a month? Did they take it for 6 months? Did they take it for a year? Right? We need to know that. We need to know the dose of natural herb X, but this was an adult. So then what would be the correct dose, the corroborating dose for a child? We don't dose children and adults the same. So how would we know how much of natural herb X to give to this child that has leukemia? Right? These are all very important questions. How about this one? What are the side effects? Now, if you're going to say it's all natural, it doesn't have side effects. So sorry, I did talk about that in the previous talk, but I will tell you this much about it now. Absolutely everything has side effects. This is what patients call it. We call it unintended effects, right? Or adverse effects, unintended adverse effects, right? This is what happens. Well, every single thing can have an unintended adverse effect. Everything, okay? Including water. Could you drink enough water to kill yourself? Sure could. Even though our bodies are made up of more than 70% water, you can kill yourself with water, right? Oxygen can be dangerous. We need oxygen to live. It's as natural as it gets. Can oxygen kill us in certain circumstances? Absolutely. So, would this natural herb X be expected to have side effects? Of course it does. Do we know what they are? No, we don't. What about other interactions? Drug interactions, right? This is important to know. What if this 2-year-old or child, I didn't say how old the child was, but what if this young child, is on other medications and we want to give it natural herb X because we saw the thing on TikTok that said that this cures the cancer? Well, if we don't know what the drug interactions are, should the child stay on the other drugs or not? Will they be affected? Will they be less effective? Will this cause these other drugs to stay in the child's system longer than expected, lead to a potential overdose of medication? We don't know. All of these things, and a few more I haven't mentioned, all of these things are what we call evidence, right? This all fits in the body of evidence. Every single drug that I give or that I am allowed to prescribe legally, right? I know these things about. I know what they treat, what the indications are. That's what we call it, indications, right? I know when to give it and when not. I know what dose to give, how much. I know what dose for children. I know what dose for adults. I know what dose for elderly. I know what dose for people with kidney injuries, right? Or liver injuries. I know all of those things for all of the pharmaceuticals that I prescribe. I know the frequency. Do I give it once a day? Do I give it every 6 hours? Right? Frequency. I know that. I know how long to give it. Should this be a 10-day course, a 5-day course? Do I give it for 3 weeks, take 1 week off, and give it for another 3 weeks? All of that is very, very, very important to know, right? For the treatment of this specific indication. I know, yeah, the duration. I know the side effects, right? FDA makes sure of that. All the lawyers, everybody is all on top of that whole list of side effects that everybody sees on every commercial. Yeah, that's thanks to the FDA. They make sure that we know, right? But then we also know what drug interactions. I know not to give it with this other drug. I know if I can give it with, with drug A and not drug C, for example. So all of these things, again, comprise evidence. The problem is we don't have those things for natural herb X. So how do I take the information that's been given to me on TikTok, on Facebook, on Insta, wherever, from somebody who has, miraculously cured their cancer on their own with whatever drug, and I don't have enough information to use that same substance for your loved one who's sitting in my office with a death sentence if we don't intervene. And I guarantee you wouldn't want me to. You would want me to use evidence-based medicine. You would want me to use the drug that we know has a 70% cure rate. And if that one doesn't work, we're going to go to the backup drug that has a 72% cure rate. Like, we have protocols in place with all the evidence based on thousands of patients that we've treated with this exact specific disease. That's why we use evidence-based pharmaceuticals as opposed to natural herbs and supplements, etc. Okay, so that's primary reason. Okay, so next question that came up after this one is, you guessed it, why don't we just study the natural medication, the natural substances or supplements, herbs, vitamins, all the things that God gives us in nature? Why don't we just study those? And then they will be evidence-based and we could use them. Fantastic question. Now, here is the thing. These things have been studied for decades. I remember seeing, I believe it was the Office of Alternative Medicine, I think it was OAM, when I was at the NIH as a teenager, right? So I was fortunate enough to be able to do research at the NIH because I grew up in DC, and NIH is, kind of right in our backyard. So I was this nerdy kid, and I always got to go do research over at the NIH. And I remember this Office of Alternative Medicine. And I was like, well, what's all that about? What's alternative medicine? And I believe it was established, I looked it up yesterday, established, I believe it was in 1994. And then they actually became one of the institutes, and they were under NCAAM. And now they're under, I'm blanking on the name. I'm going to look it up just because I want to give you accurate information. But how about this? I'm not going to look it up. I'm going to give you some homework. How about you look up, does the NIH study alternative medicine therapies? And you will find the answer. You will find the name of the institute, the NIH, National Institutes of Health. I'm sorry, I'm speaking in words you might not know. So the National Institutes of Health is our nation's premier biological resource institute that's funded, guess by who? No, not by pharmaceutical companies. Not by people with special interests. It's funded by you. Your tax dollars fund the National Institutes of Health. Okay, and it was designed to be set up in that way by Congress. All right. So if you're wondering why they aren't doing research, technically you are the they. It's your money that's funding the research. Now, not just yours, mine too, a lot of mine, tax dollars funding this research. So the NIH, National Institutes of Health, that's plural because there are multiple institutes. And I forgot the number the last time I checked, 27, 28. I forgot. So definitely do not quote me on that. We can just fact checked how many institutes are there. And you've got the Diabetes and Kidney Institute. You've got the Cancer Institute, right? I worked in the Cancer Institute quite a bit. You've got NINDS, which is the neuroscience. You've got, all kinds of different institutes, right, that are studying different aspects of human health. That is their mandate. There's also an institute for alternative medicine. Literally, they get their entire own institute to study the different types of alternatives to pharmaceuticals and to what we presently have in our body of evidence-based medicine. They are studying alternatives to those. So that is happening. You can go look it up and see if I'm lying. Okay. That is a fantastic thing. Why? Because if there is a natural herb X that is actually out here curing cancer, we all want to know. And our own tax dollars are paying for us to know, right? There are people researching these things to find the answers. That is really, really important. So the question about why aren't they doing research on these natural substances? The answer is they are. Okay. Now, the other thing to remember, research takes time, especially research in humans, right? Takes time and a whole lot of money. So one of the things that everyone is saying is like, oh, well, pharmaceutical companies don't want to research natural things because it won't help their bottom line. That is a true statement. Now, as a company, now let's put on some entrepreneurial hat or business hat for just a second. If you're a company, your entire existence is based around making money. That's why you exist as a company. Now, I just mentioned these research projects, especially ones research trials in humans, to determine the effectiveness of any substance, are expensive. I mean, hundreds of millions of dollars, and expensive with time. It takes years, sometimes up to a decade or more, to prove the efficacy of of any particular substance, to find out all these different things. What are the indications? When can it be used? What doses are effective and which ones are not? All these things, that takes time and money. And if you are a business, why would you do something that takes away your time and money? That literally doesn't make sense. So they don't do it. Okay, business hat off, entrepreneurial hat off. Let's see if we can't get to the next question. Next question I had recently. Okay, completely different subject, which is fantastic. This question: why do some drugs have to be taken on an empty stomach, and some have to be taken with food? That is a fantastic question. A lot of it has to do with biochemistry. I know this is exactly what you guys wanted to talk about today, right? Biochemistry. Very fun subject. Not my favorite, but absolutely necessary for understanding the interactions of molecules and substances once they enter your body. Okay? So we can start at the beginning. You got a substance that enters your body. Ooh, don't laugh at my bad drawing, y'all. Okay. So we've got a substance that enters your body. Okay. So here's your mouth over here. And then this is your esophagus, right? It's going to go down. And then we've got your stomach just hanging out, something like that. Okay. Stomach. There we go. Now we've got all these, right? You take a pill or you take a liquid, or you take a supplement, whatever it is you take, it goes in your mouth, down your esophagus, and into your stomach. All of them do that, unless it's an injection. And we're not talking about injections at this moment. So, goes down here. What happens in the stomach? Very important for this biochemistry part. There's an acid bath down here. So I'm just going to write acid. Now, the other way to write that, if we were really going the chemistry route, I only have so many colors of pens. Okay. The other way to write that would just be to put H's, H plus. Lots of hydrogens, right? The more hydrogens you have, the more acidic you are. Why does this matter? We're gonna go down a little rabbit trail, just a little bit. Some people like these rabbit trails, so it's okay. It's gonna be helpful information. This acid in your stomach is very important, okay? Why? Well, because you need to break down things that you put into your body. What things do we put in? Well, medication, supplements. We also put food in there, right? Food into your mouth, down your esophagus, into your stomach. Well, how do you break down food? Primarily in two different ways. So you have mechanical. Where does mechanical happen? Up here at the mouth with the teeth, right? The teeth are going to help us to break down mechanically, right? We're going to chew, we're going to shred, we're going to morcellate perhaps. But yeah, we're going to break down food into smaller and smaller particles by chewing it. That's mechanical breakdown of food. That's very important, right? The next very important part is the chemical breakdown of food. We need acid to do this. Now, how strong is this acid? A good example I like to use. A lot of people might be familiar with battery acid, like battery acid as in the acid that's inside the battery in your vehicle, right? People maybe have had some type of interaction at some point in their lives where it's like, oh, be careful, don't let the acid spill. Definitely don't let it spill on you, right? Don't touch it. It's corrosive. Like if you stick your finger into the battery acid in your car, it will melt the flesh off the bone. Very strong acid, right? Acid in your stomach is stronger than that. It has a lower pH than battery acid in your car. It's extremely strong. Why? Because it offers the chemical breakdown of literally everything that you put in your mouth so that it can pass through your system, which I didn't draw the rest of the system. That doesn't stop. It just keeps going, right? So this is important. People like to try to change the acidity in your stomach, and I don't understand why. It's there for a reason. It's literally by design to do the things that it's been designed to do, i.e., to chemically break down substances. And so if we're wanting to change the pH in our stomach, I mean, you could temporarily, is what you could do. I mean, it would only be temporarily because your body works hard. There are actually cells in your stomach that are designed to pump out acid. Like, I'm telling you, like, the design of the body is absolutely amazing. And those cells, of course, are only in the stomach, right? They're not in the esophagus. They're not in the mouth, right? Like, you don't have a mouth full of acid. You don't have a stomach full of acid on purpose. It's really beautiful. So anyway, so you break down products that you put into your mouth here with the stomach acid. I completely forgot the question. Oh, some things have to be taken on an empty stomach and some things not. So back to the biochemistry fun stuff. Now, some things need to be taken on an empty stomach because they are activated or they are most potent at a certain pH. Here comes the biochemistry. pH just means how many hydrogen atoms are around, okay? So when there are more of these hydrogen atoms around, i.e. your stomach is very acidic, that's when your stomach is empty, okay? So when your stomach is empty, there's more acid. More acid, you can take those things that need to be taken on an empty stomach and they'll be activated, right? They're more effective. They're absorbed better. All the things that are necessary in order for them to be active in your body happen at a pH that has more H's, which means the pH is lower. Okay. Now, what happens if we eat some food? Because some medications or even supplements are supposed to be taken with food. Well, what happens when we eat more food? We start to increase the alkalinity, which means we decrease the hydrogen atoms, right? So there's less hydrogen atoms. So your stomach is less acidic when you eat, right? That's what happens. So when that happens, that becomes the pH that is proper for the absorption or the effectiveness of the medication that's supposed to be taken with food. Okay, so I'll just write it here. More hydrogen equals lower pH. Okay, and I'll write over here less hydrogen equals higher pH. So how do we make the hydrogen less? With food. Pretty much. That's the normal way we do it every day. It happens, right? Then how does it get low again? Again, your stomach has cells in it that literally secrete acid. That's what they were designed to do. That's what they do for their entire lifespan. Okay? They secrete acid and they make this more and more acidic, as it should be to digest the food. Okay? So if you want to take a medication on an empty stomach, you want it to have a lower pH, so you take it without food. And then if you need something that has a higher pH, it won't say you need to have a higher pH. It'll say take with food. And there's your biochemistry lesson for today. I know that's exactly what you were hoping for when you asked for that question. All right, and that's all the time that we have. Again, if you have any questions or if you would like for me to address anything in particular, feel free to put it in the comments. Let me know. I'd be happy to do so. Until next time.